I'll be talking about a crucial topic in the neuroscience field, which is neuroplasticity, also known as neural plasticity or brain plasticity. It is becoming highly trending these days. However, scientists are taking advantage of this concept for them to improve learning abilities, memory, and even developing applications that help people train their brains, aiming for faster thinking and information retention for a longer period of time. What's neuroplasticity? It is the ability of the CNS, or central nervous system, to remodel itself and to restructure its neural connections. It is how people adapt to changing conditions, learning new facts, and developing new skills, and it is constantly occurring. The brain is always changing. In the past few years, there was a scientific consensus that the brain only develops during a specific period of time in the childhood, so the structure does not change with age. Bakirita is one of the first neuroscientists to create modern direct applications of the neuroscience field. He developed the BrainPort device, a camera that picks up the image of the surrounding. The captured information by the tongue is converted into electrical impulses that are sent to the brain via electrode array, and the brain reads these impulses as visual signals and redirects them to the visual cortex. So we can say now that we see in our brains, not with our eyes, proving that touch signals were redirected to the visual cortex and proving the existence of adaptation abilities of the brain. Now, in an intact somatosensory system, there are two distinct areas that respond to touches at skin area A and skin area B, innervated by two different nerves. Nerve B is damaged. 2 days after, it degenerates and the cortical area starts to reorganize itself all over again, knowing that the same area which originally received input from nerve B is now deprived from it. The area that used to receive inhibitory input from cortical area B becomes disinhibited and starts to respond to touches at skin area A. 6 months after, nerve B is completely degenerated, and we can see that cortical area B is completely rewired. In 6 months, we have a complete rewiring and organization of the cortical map. Let's take the example of the phantom limb. A man had an accident and lost his right leg. He may develop the feeling of a phantom limb because the areas of the somatosensory cortex that are near the ones of the leg will take over and remap the region that has no longer input. The person will keep feeling that something really exists. Now I'll be talking about the cortical remapping for people with deafness and blindness. Concerning deafness, all visual areas increase in size and functions, and auditory areas may be taken over for visual functions. Concerning blindness, larger somatic representations in sensory-motor cortex, and stronger connections between sensory-motor and visual cortex. Let's take another example of cortical reorganization. When Jody was 3, she started having seizures and was diagnosed with a rare disease, Rasmussen's encephalitis. It's a rare autoimmune disorder causing a huge number of seizures a day. Doctors told her parents the best way to treat her was to remove half of her brain. The girl is now a speech pathologist, and taking into account that her story is a major proof of neural plasticity and brain remodeling. Two main epochs of the plastic history of the brain. The first one is the critical period when the brain sets up its initial processing machinery, when dramatic change occurs, and the second is the adult plasticity, when the brain refines its machinery as it masters a wide repertoire of new skills and abilities. We have two main types of neuroplasticity. The first one is the developmental plasticity that occurs over our lifespan but diminishes with age, and it tackles all changes in the neural connections as a result of interaction with the environment as well. We can talk about synaptogenesis, synaptic pruning, neural migration, and myelination. The second one is adaptive plasticity, which is the brain's ability to compensate for lost functions due to brain damage, and it is more effective in childhood. So we can talk about rerouting and sprouting. Concerning structural change of the brain, it has many causes. First, we have neurogenesis, so new neurons are generated and differentiated from progenitor cells and migrate into new areas, and we have the synaptogenesis, changing the internal structure of neurons. There are two main theories of neuroplasticity. The first one is the enhancement of existing connections, and the second one is the formation of new connections. When we talk about enhancement of existing connections, we can talk about synapse development. It is a physiological pathway that takes milliseconds to hours. And we can talk about synapse strengthening, which is a biochemical pathway, and it takes hours to days. Concerning the formation of new connections, we can talk about unmasking of silent neurons, which is a physiological pathway that takes minutes to days, and we can talk about sprouting, which is a structural pathway that takes days to months. Last but not least, the role of therapies such as psychomotor therapy, occupational therapy, and rehabilitation is to strengthen and develop normal synapses and to guide axonal sprouting.